Good morning, my name is Jana and I'm a fourth year medical student at the University of Exeter. In this video, I'll be talking about how healthcare workers can improve their communication skills with both deaf and mute patients. In all walks of life, communication is a basic human skill required to interact with others. This necessity allows us to fulfill our needs, improve our quality of life, and overall increase our likelihood of survival. Although the skill cannot be perfected, it can be improved. Doctors, nurses, and other healthcare workers are examples of people who benefit from improving the skill. Good communication skills are required when creating an interpersonal relationship, facilitating the exchange of information, and including patients in decision making. Regardless of people's level of ability when it comes to communicating, some instances may arise where anyone would struggle. These include situations where patients may suffer from speech and language disorders. Whether it be through physical or mental disabilities, neurological disabilities, or trauma, patients can lose their ability to speak or hear. These deaf and mute patients may be unable to communicate their thoughts, feelings, and needs fluently, which can in turn provide a great task for clinicians. There are general improvements we can make when it comes to all patients, and then more specific tips for each mute and deaf patient. Starting with what we can do for all patients, before we even open our mouths, we think about our body language. When communicating a message, words only make up 7% of our communication, whereas our tone of voice makes up 38% and our body language makes up 55%. This means that 93% of our communication is made without our words, and it is in the tone of our voice and body language that our meaning is conveyed. We can say a word or sentence but give a completely opposite meaning through the tone of our voice and the look on our face. Some non-verbal cues we can implement prior to and during the consultation include bending or kneeling down to the same eye level as the patient, avoiding closed body language like crossing your arms or using quiet voice, and placing a hand on their hand or arm at the appropriate moment. This idea of prioritizing non-verbal communication also works the other way. We need to be picking up on the patient's non-verbal signs that they may be displaying. This can inform us greatly of what is going on with them, even when they're not communicating verbally. Next, we have how we can best communicate with mute patients. As these patients can hear us, the majority of communication improvements are the ones we have just mentioned, alongside the standard giving information techniques we use with non-mute patients. However, in terms of what else we can do, as practitioners, there are hospital protocols we can follow to help our patients. We must inform patients that free support is available, and upon the completion of an 849 form, we can find what best suits their needs. For mute patients, these include a simple method such as a paper or pen or portable teletype, allowing patients to type their response into a phone. For what we can do for deaf patients, once they've also completed the 849 form, we can arrange for them to have telephone amplifiers if they still have some hearing, or give them access to DeafTalk, an application that provides access to British Sign Language interpreters over a video call. In this instance of those methods being arranged, there are some simple sign language terms that we can use in the meantime. I thought we'd go over some of these common phrases in British Sign Language that will be helpful when you first meet a patient. For what is your name? Name, you, what? I'll do it again. For what is your name? Name, you, what? We can also do what is your date of birth? Date, birth, when? If you wanted to know a patient's date of birth, date, birth, when? Another one we can do is, are you in any pain? So, pain. Are you in any pain? Pain. For please and thank you, it's the same sign. So we'd move our hand away from our mouth, please, and thank you. Please, and thank you. And if you wanted to ask the patient if they had any questions, it's just drawing an exclamation mark. So, questions, questions. And these are some of the signs we can use when we first meet a patient whilst those means are being arranged. In conclusion, improving our communication skills with both mute and deaf patients is crucial to providing quality healthcare. By being observant and using alternative methods of communication and creating a supportive environment, we can establish a strong connection with our patients and provide them with the care they deserve. Thank you for watching. I hope you have enjoyed the video. Goodbye.